In Part 7 of Module 11 on entitlements, we'll discuss the State Children's Health Insurance Program, SCHIP. The State Children's Health Insurance Program, or SCHIP, is a state and nationally funded program that began in 1997. The program is intended to extend health insurance to children who would not meet income requirements of Medicaid. Eligibility for SCHIP is a function of a child's age, family size, and household income level. The SCHIP program serves children from the working class and middle class families. This health care entitlement helps these families remain in the middle class and working poor categories. Without this health care entitlement, the eligible families would lose their socioeconomic status in the case of any type of serious medical condition arising for their children. SCHIP offers health insurance, emergency medical care, immunization programs, and a health screening program. SCHIP also helps reduce the cost of adult health care by managing health care needs of adolescents before the health problems become chronic and expensive to treat. Childhood obesity has led to serious concerns about the future health care needs of Americans. Related to obesity, many children are being diagnosed with diabetes, which can lead to other serious health care issues, principally vision, renal, coronary, and circulatory disorders. Obesity itself can also lead to heart problems, stroke, and premature death. Increasing access to medical testing, preventive treatment, and information through the insurance resources of the SCHIP program means that chronic health issues can either be prevented or effectively treated to forestall serious health consequences in many cases. Enrollment in SCHIP has risen dramatically since 2000. In just 6 years, enrollment has increased from 3.36 million children in 2000 to over 6.6 million children in 2006. In percentage terms, the increase has been over 97%. SCHIP expenditures also reflect this tremendous rise in program enrollment, which increased from $1.93 billion in 2000 to a staggering $7.03 billion in 2006, nearly a 511% increase in expenditures in just 6 years. In 2019, the amount of SCHIP expenditures was nearly $20 billion. A state-federal entitlement, SCHIP is a noteworthy commitment to many middle-class American families with young dependents, helping many of those families to avoid economic devastation and offering hope to millions of children. What certainly cannot be ignored, however, is the rapid growth of the program and the constraints that level of growth places on state budgets. State program managers must prioritize and manage a myriad of state and local community needs. Successful, sustainable communities possess the capability of relying upon the ability of individuals and families living in those communities to respond to changing conditions and needs. SCHIP helps working-class families whose relatively acceptable economic status could quite easily be transformed into economic devastation by health care needs of their children should serious illness occur. This program allows these families to maintain the slack resources needed to respond to other changing needs, such as care for an elderly relative or cover the cost of further education. Slack resources might also be used to help other community members in times of need, providing shelter and food for a neighbor who lost their home or suffered a medical malady that will require support of their close friends. In Part 8 of Module 11 on entitlements, we'll discuss unemployment compensation.